Have you ever heard of muscular dystrophy? It's a genetic disorder that isn't really talked about that often. So, what exactly is muscular dystrophy and how does it affect those who have it? There are many different types of muscular dystrophy, but the most common and most severe form is Duchenne muscular dystrophy, commonly referred to as DMD. This is Kevin. He has muscular dystrophy. Let's learn more about Kevin's life by going back to when he was an unborn baby. When Kevin's DNA was being formed, something went wrong. The base pairs that were supposed to join together didn't, and so due to changes in the letter sequence that makes up DNA, a mutation developed. The reason for this mutation could have been genetic, it could have been passed down from his family in an X-linked recessive fashion, or it could be caused by what scientists call a high spontaneous mutation rate. This mutation means that Kevin's body is unable to make the protein it requires for healthy muscles. If we fast forward a few months, Kevin has been born. His parents are very happy. Their baby looks happy and healthy. Kevin is having a fairly normal first couple of years, but one day his parents start to notice he has very weak muscles. As Kevin was getting older, his parents noticed more things about him. He would often stumble while crawling and walking, and he had a lot of trouble going upstairs. He started walking on his toes instead of his feet, and he found it really hard to push his bike. His eyes often drooped, he had very poor balance, and he had a lot of muscle spasms. Kevin's parents took him to see a doctor, and that's when they realized he had Duchenne muscular dystrophy. Over time, the muscles in Kevin's shoulders, back, legs, and arms began to weaken, and he was in a wheelchair by the time he was 12. As the disease progressed, he eventually completely lost the ability to walk, breathe easily, sit upright, and move his arms and hands. In terms of intellectual ability, Kevin, like most people with DMD, is of average intelligence, but about 1/3 of DMD patients experience learning difficulties, and a small percentage are intellectually disabled. DMD is usually detected in patients when they are children. Children will usually have a fairly normal first couple of years of life and will begin to show symptoms somewhere between the ages of 2 to 5. From the ages of 6 to 11, there is a significant decrease in muscle strength. When trying to detect DMD, the doctor will usually ask if there has been any family history of muscle weakness and ask if the child is showing any symptoms. There is usually a physical test involved and often a muscle biopsy, which is when the doctor surgically removes a small sample of muscle and tests it by looking at it under a microscope. Muscles affected by DMD will look different and have lower levels of dystrophin, a protein that helps muscles keep their shape and length. 1 out of 3,500 boys has Duchenne muscular dystrophy. Girls can carry the gene, but will rarely have any symptoms. So, what are the social issues involved with Duchenne muscular dystrophy? Children affected by DMD will be greatly inconvenienced throughout their lives. As I mentioned earlier, they will usually be in a wheelchair by the time they're 12 and will not be able to move their arms or legs. They may have troubles learning and usually need to be accompanied by a carer because, unfortunately, it's difficult for them to look after themselves. To conclude, here's what I have learned through researching this genetic disorder. It is caused by missing or incorrect information in DNA and is usually diagnosed in children. It is basically the weakening of muscles when tissue turns into fat. There is no cure, but scientists are working hard to find ways to slow the course of the disease so that people like Kevin can live a long, happy life.